It's Thursday, and as is the custom now, we're joined by In Focus health correspondent Linord Moudou. And I know that today we have some not very good news that you're giving us, isn't it?
Yeah, well, it's about some possible cutting on funding for AIDS research. The global financial crisis cast a shadow over a recent conference on AIDS in South Africa. Participants of the world's largest gathering of HIV/AIDS experts learned of possible cuts in funding for AIDS research and prevention. 1,000 scientists and delegates attended the recent conference of the International AIDS Society in Cape Town, South Africa. At the conference, HIV/AIDS activists were on the defensive. While they argued for billions of dollars in new financing, they also felt obliged to respond to a small group of academics who questioned the high percentage of health funds devoted to AIDS.
I think the message is some people are under the mistaken impression that we've solved AIDS, that we've solved HIV, that now we know how to treat it, we can get it out there, and it's all, the answers are there. I believe there are lots of answers at the pathogenetic level, at the research level, as well as the implementation level, and we have to continue to push the science and push the implementation and push the practice based on evidence.
The Global Fund to Fight AIDS, Tuberculosis, and Malaria wants up to $30 billion next year to replenish its funds. However, the fund's executive director, Michel Kazachkine, says he is concerned the G8 will not meet its funding pledge.
If the G8 countries were to keep and honor their commitments of Gleneagles, then that money should be available. So we're not asking, we're asking for numbers that appear large to you and me, but that are peanuts if you look at the wealth that is generated every day in the world.
Since its launch by the G8 nations in 2002, the fund has distributed grants worth $16 billion to 140 countries around the world, mainly in sub-Saharan Africa. However, a global economic downturn, coupled with a sharp increase in demand, has raised concerns whether rich countries will meet elevated funding targets. Kazachkine says funding should be available if the G8 countries honor their commitments to double aid to Africa to $25 billion a year by 2010.
It's a global epidemic. We need a global response. We need a global fund. We need a global solidarity.
For patients at a clinic in Guguletu in Cape Town, increased funding to fight HIV/AIDS means that they will get to live a little longer.
It's very beneficial to the patient because it gives them life. If we monitor those HIV positive patients, then you can be able to, the patient can be able to live a better life and a longer life.
G8 leaders have promised near universal access to all those in need of treatment for HIV/AIDS by 2010. And for more information on these stories, you can go to voanews.com.
And thank you very much, Linord, for joining us today. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.